Tell me about your life before the surgery.
Well, I thought I had a pretty good life up until the time I started having that pain in the back, which lasted a long time.
Yeah.
You know, and I saw a lot of people for it and all that stuff, and it, tried to fix it, and it didn't work, and it just kept on and started to disrupt my life.
Yes.
My golf game suffered, and I didn't enjoy it as much, and that's when I decided I better come and see you.
Yeah. Now, you said you did lots of other treatment for the back pain you had. How bad, 1 to 10, was that back pain when it was bad?
That was probably about maybe a 6 when I wake up, and then my family practice doctor gave me some tramadol to take. And not a lot, but it gave me enough relief to play golf.
So how many years did you have that pain?
I don't, a lot of time. I started treating this back when I was probably in my 30s. So I'm 79 now.
Yeah. Now, you're 79 and you're a healthy 79, but nevertheless, you had a scoliosis and your spine was actually about 30 degrees side bending, meaning that was bending to the side. This is the picture from today. Your spine is as straight as it can be, and it's not really side bending anymore. And here, it's very straight now. And as well, we see that the bone is growing. And we did here, we see that the screws are in place, bone is growing. And everything is good now. This surgery was about 11 months ago, And
we're almost a year now.
Yeah, almost a year. Now, for almost an 80-year-old person, this open old-fashioned surgery would be extremely demanding. So we decided to do your surgery minimal invasive with the Olive technique. And I have actually the study that's important information from the surgery itself. As well, I have our pre-op record that says, your pain with activity could be even up to 7 and 8 if you would do something. 1 to 10, how bad is the pain these days?
Well, the toe is the pain. That's just mainly numb.
Mainly numb, okay.
The back, I know that it hurts when I walk, and the cane helps, and some days I can hardly feel it at all. I'll walk around the house. But I'd say on the average, that'd probably be about a 4 or 2.
Yeah, so it's much better.
Yeah, I would say so.
Yeah. And what do you think about his life and the pain and activities? What do you think? What's your observation?
Well, I didn't live with his pain.
Yeah,
but
I know.
This last year has been a struggle, but
because
of the nerve and the leg.
Yeah.
The actual surgery and the back, I think, has helped him.
Yeah.
But it's the leg.
Yeah, and that is the point, that this reason for this expectation management. We tell our patient 1 in 7, about 15% of the people will have nerve irritation, and you did have a nerve irritation. By the way, I just check your foot. Can you put it in front of you and wiggle it for me? Wiggle it, yes. And push up, yeah. Yeah, it is actually getting much stronger. So it's getting better. But you did have that nerve irritation, which you didn't have before.
Right.
So, but the idea is here that no surgery comes free of risks.
Right.
And this was one of the risks that we discussed before the surgery. And by the way, open old-fashioned surgery put the spinal cord and the nerves at risk. This surgery only put the nerve root at the risk. And but it seems that it's recovering. Do you feel it's recovering?
Oh, it's recovering.
Yeah.
It seemed like a long time, but it's been recovering.
Yeah, but this is the surgery just not even a year ago. It still will recover up to 1.5, 2 years. And again, the idea is here, the alternative to this would have been an open surgery, which somebody who's 80 years old, that would not have been an option.
Right.
Okay. Because how do you know that? You say you know that. How do you know that would not have been an option?
Because he went to 2 neurosurgeons before, and they said they would not. He was not a candidate for surgery.
So they told you, you just have to live with that pain.
Well,
they did injections. They tried all of that.
I did all that, and then I actually met with 2 neurosurgeons in Fargo.
Mm-hmm.
And the first one said no, he wouldn't do it.
Mm-hmm.
And the second one, he was kind of cocky, and he
neurosurgeons have that on them sometimes. Yeah,
but
sorry for that.
He really said, I will not do it. If I did do it,
Mm-hmm.
it would be a 12-hour surgery, and you would be stiff as a board all the way up.
Yeah.
And then now I tell people, he said a 12-hour surgery. You did it in 3.5.
No, actually, my actual surgery time, the minutes it took me to do the surgery was 88 minutes. Less than 1.5 hour, and our blood loss was 95 cc, like about 3 ounces or so.
Yeah.
So not really much.
That's not long.
And you stayed in the hospital only 2 nights. That's what my record says. So, but you see that there, the problem with problem is that the open old-fashioned surgery is so risky that cannot be done safely.
Right. And
That's out of question, and they weren't wrong. Your 80-year-old body wouldn't take a 12-hour surgery and half a gallon of blood loss. Wouldn't make it. But obviously, you made through the surgery quite all right. Our blood loss was minimal, only 2 nights in the hospital. But what is testimonial is about is patient expectation management, because our surgery is still a surgery, still have some risk. Even though it's much safer than open old-fashioned surgery, it is not risk-free, and you had that risk. So you're not my best patient, because my best patient don't have that.
I know.
Oh,
They go after a month, they come back and they're all happy and so on. But I think it's important for my patient in the future as well know that this is a possibility, but the alternative would have been either open old-fashioned surgery or no surgery at all, and then living the rest of your life with the pain.
No, I didn't want to do that.
No, and the idea as well is a very important idea in this regard is that it's not that you have just pain. If you have pain, you don't walk. If you don't walk, literally in your age group, if you don't walk, your body shuts down.
Right.
So that can be a deadly situation. People don't have the surgery, then they walk less, then their heart and lung, they decondition.
Right.
And then 6 months later, a year later, it's your heart and lung that will get you, not your back. So these are not unrelated issues. So in that regard, having numbness on top of your left foot, the risk of the surgery is a lesser evil than you are not able to walk.
Yeah.
It's not only pain, you're not able to walk, and you succumb to cardiovascular issues. And we have the data. We know that those things are real. That
Right.
people who don't walk, their life we know at your age group, if you don't walk, doesn't matter for whatever reason, your life expectancy is shorter than people who are diagnosed with
See,
cancer.
I tell you gotta walk home.
Well, I haven't been able
Small
to
frequent
walk.
walks, yeah. So it's not perfect, but so far I'm very happy with the result because bone is growing.
At this point, I would say we are too. If you would have asked me
Yeah.
3 months after surgery, I would have said no.
Yeah.
You would never do that again because it was not.
It was
fun.
tough.
It was not
It was
fun.
tough. That's why they call you patient.
Yeah.
Yeah.
Because it's hard to be patient and
Yes.
let your body do the healing. Open old-fashioned surgery has significant more risk and dangers to you.
Oh, he would never have
Yeah.
done that.
Yeah.
He would never
Well,
have done
I hope that I never see you again because bone is growing. Things are getting better even in the foot.
The only question I have
Yeah.
is this drop foot, do you think it's going to go away?
It has gotten significantly stronger. It used to be 3 of 5. 3 of 5 meaning you barely could lift it up. In the last visit, it was 4 minus. It's now 4, meaning that it's already getting stronger.
Great.
It's still going to get stronger in the next half a year to a year, and but we have to work on it. And what I understand is most of the pain is gone down. The numbness is what's bothering
Right,
you.
yeah.
So, are you planning to go back on the golf course?
Oh, yeah.
Yes,
He's-
Tomorrow morning.
tomorrow morning.
He's been golfing, but
I've
it's
been
been
playing,
a
but not
struggle.
Yeah.
very much. I
And
usually
not
play
very
quite a
well.
bit.
Well, they say life is fun, golf is serious.
Yes.
I think he's an example for
I
that.
know.
Okay.
I think you're right.
Yeah. Well, I think we are going in the right direction. I'm happy with the result. We are going the right direction. Obviously, it has been a journey. It has been difficult, but I think comparing to what the alternatives are or would have been, this is a good outcome. That the pain is increased, your activity is increasing, and this will still get better, but just like anything else. That's why we talk about this risk before the surgery. So because you cannot beat the statistic.
Yeah.
It's not just a statistic.
When you read that though, and it says 15%, you go,
Yeah.
"Oh, we'll never be that." In that
Yeah,
15%.
and you know that
Right.
yeah, here you are, and people usually when you have it, you don't care that all the 85% of the people improve.
Exactly.
For you matters what's happening to you, and it can be discouraging. Okay,
It is.
so well, yeah, my heart up to you. You made it through. Okay. Well, thank you so much. I appreciate that. Okay.